Thanks for tuning in to the Ultimate Guide to the 2020 Compass Rose Health Plan, hosted by Compass Rose Benefits Group. We're happy to have you here. If you are a new member, welcome! Compass Rose Benefits Group is a not-for-profit association that has been offering comprehensive insurance solutions to federal employees and their families since 1948. We originated as the preferred plan for employees of the Central Intelligence Agency. Over the years, we have expanded our eligibility to include active and retired civilian employees of the intelligence community, Department of Defense, U.S. Coast Guard, and Department of State. We're here to help you navigate the complexities of insurance and make your coverage simple and easier to understand. Today, we're covering the ins and outs of the 2020 Compass Rose Health Plan. You may move back and forth throughout this webinar at any time. First, you'll see a high-level overview of the Compass Rose Health Plan, including our plan highlights and important healthcare terms you should know. In Part 2, you'll better understand how your doctors and lab visits are covered with our insurance plan. Part 3 provides a brief overview of our prescription drug program and tiers, along with helpful tips to make getting your medications easy and convenient. Part 4 reviews our overseas coverage and what to expect when you're traveling. In Part 5, you'll learn about how we coordinate benefits with Medicare. Finally, Part 6 covers our exciting health and wellness programs available to eligible members. Each section has a quiz at the end to test your knowledge of the 2020 Compass Rose Health Plan. We'll also provide helpful resources and contact information so you can bookmark them for future use. Let's get started. If you are currently enrolled in our 2020 health plan, congrats! That means you are part of an exclusive membership that only our nation's elite can join. We are happy that you have selected us for your healthcare needs. In order to help you better understand our health plan, we wanted to start by reviewing some key terms. The Compass Rose Health Plan is a high-option federal employee health benefits fee-for-service plan. A high-option plan, not to be confused with a high-deductible plan, provides more comprehensive benefits than a basic plan. You may pay a little more in premium than you would for a basic plan, but you will have lower out-of-pocket costs throughout the year, such as lower copays, lower deductibles, and lower coinsurance. Your premium is the amount you pay from your paycheck or annuity for your health insurance plan on a biweekly or monthly basis. A deductible is the annual fixed amount you pay for certain covered services and supplies before the health plan starts paying for them. Some examples of services that are covered before you meet your deductible include in-network preventive care, maternity care, surgical procedures, inpatient hospital room and board, hospice care, and prescriptions. The out-of-pocket limit, or catastrophic maximum, is the most you could pay in a year for covered services. A copayment is a fixed amount of money you pay to the provider, facility, or pharmacy when you receive certain services. For example, when you go to your primary care doctor's office for a sick visit, you will pay just a $15 copay if they are in-network. And if you saw an in-network specialist, like a dermatologist, cardiologist, or obstetrician, you would pay a $25 copay per office visit. Coinsurance is your share of the cost for covered services calculated as a percentage. For most services, coinsurance doesn't begin until you have met your 2020 deductible. One of the biggest questions our members ask is, how much does our plan cost? Our plan rates are different based on the type of enrollment you choose. This chart shows the breakdown of biweekly premiums, which range from $101.66 for self-only coverage to $263.37 for you and your family. This is the amount you can expect to pay from your biweekly paycheck. If you receive an annuity on a monthly schedule, your rates can range from $220.26 for self-only coverage to $570.63 for self and family per month. Your premium is not the only cost to consider. You should also be aware of your deductible and out-of-pocket maximum, as mentioned in our Terms to Know section. The chart on your screen shows the annual deductible for our 3 plan types. The 2020 in-network deductible for a self-only plan is $350, and for a self-plus-one or self and family plan is $700. The in-network out-of-pocket maximum is $5,000 for self-only plans and $7,000 for self-plus-one and self-plus-family. Now that you understand a little more about your total healthcare costs, it's time to get into our plan highlights. This is just a brief overview of what members receive with our coverage. You'll learn more about each throughout our webinar. Some exciting features of the Compass Rose Health Plan include free in-network preventive care, low copays, a nationwide network and worldwide coverage, no referrals, telehealth, and wellness rewards. All right, it's quiz time. Here is your first quiz question. What is a deductible? Is it A, the amount you pay from your paycheck or annuity to have healthcare coverage? B, a fixed amount of money you pay to the provider, facility, or pharmacy when you receive certain services? Or C, the annual fixed amount you have to pay each year for certain services before your insurance starts to pay? The correct answer is C. If you remember from our Terms to Know section, a deductible is the annual fixed amount you pay for certain covered services and supplies before the health plan starts paying for them. Now let's move on to part 2. Understanding what is covered when you go to the doctor can be confusing. We're here to help. In this section, we'll go over what you can expect to pay at in-network providers. The Compass Rose Health Plan is a nationwide plan powered by the United Healthcare Choice Plus Network. As a preferred provider organization, or PPO, you have the freedom to choose your doctor or hospital anywhere in the country without any referrals. Using in-network providers and facilities can help you save on healthcare costs. With the Compass Rose Health Plan, you are covered at 90% when visiting a network provider. Out of network, you are still covered, but at 70%. Overseas services are covered at 90%, which you will learn more about in Part 4. You can locate in-network providers near you by using our online provider directory. When making an appointment, it is important to verify that the provider is part of the United Healthcare's Choice Plus network, as some providers may not recognize the Compass Rose Health Plan name. It's now time to move on to your expected costs for various covered services, so you can go into your next health visit with confidence. For routine in-network preventive care, telehealth, maternity care, and lab work, you pay $0. In-network primary physician visits or specialist visits require a copayment of $15 and $25 respectively. There is also a copay for urgent care visits, emergency room visits, and inpatient hospital care. Other services, such as x-rays, acupuncture care, or surgical procedures, require a specific percentage of the plan allowance, which you can see in greater detail on this chart. Another way to estimate your cost for care is to use the Health Cost Estimator available through your member portal account. Plus, you can earn 50 reward points just for using it. We'll talk about the member portal and wellness rewards program in Part 6. For our existing members who have renewed their coverage, there are some changes to doctor and lab visits to keep in mind this year. In addition to LabCorp, covered lab services at Quest Diagnostics Lab are now paid by the plan at 100%. When provided at a network facility and done by a network provider, members' first mammogram and colonoscopy of the year are covered at 100%, regardless of whether it's a preventive screening or more diagnostic. Our emergency room copay has increased to $200. And the catastrophic out-of-pocket maximum for in-network medical and pharmacy coverage has increased. Let's test your knowledge of the healthcare coverage. How much does the Compass Rose Health Plan cover for in-network services? Is it A, 70%, B, 90%, or C, 50%? The correct answer is B, 90%. You've made it to the end of Part 2, Navigating Doctor and Lab Visits. We know that was a lot of information, so here are a few helpful resources to bookmark for future reference. Want to find the right in-network provider? Use our directory to find care that is right for you. To get a short, easy-to-read summary, or to access the charts we showed you in this section, you can download the plan overview by visiting the link on your screen. Now that you understand a little more about your coverage for doctor visits, lab work, and other services, it's time to go over our prescription drug program. Our prescription drug plan is provided through Express Scripts, utilizing their National Preferred Formulary and network, giving members access to preferred generic and brand name prescription drugs and thousands of retail pharmacies across the country. Our goal is to provide members with convenient ways to receive their medications. That's why we offer various options to fill prescriptions at a retail pharmacy or via home delivery. Members can fill prescriptions at thousands of pharmacies nationwide. To locate a network pharmacy near you, go to express-scripts.com/pharmacy. You can also skip the trip to the store and use home delivery for maintenance drugs that can be prescribed for at least 90 days. This option is easy, convenient, and there's no cost for shipping. Plus, you receive 3 months for the price of 2 with this option. Your cost may vary depending on what medication you need, how you get it delivered, and whether you have Medicare Part B. This chart is an excellent resource to show what you can expect to pay. For example, a 90-day supply of a generic drug is just a $10 copayment through home delivery. Or you can expect a $5 copay for a 30-day supply of a generic medication from an in-network pharmacy. If you are enrolled in Medicare Part B, we offer lower copays for your prescription drugs. The amount you can expect to pay for your medication with Medicare Part B is shown on this chart. Copayments start at just $3 for a generic 30-day supply from a network pharmacy. There are some updates to our pharmacy benefits to keep in mind as we go into 2020. We now offer a 90-day supply of covered medications at a participating CVS or Walgreens pharmacy. Before, a 90-day supply was only available through home delivery. Please note, the 90-day supply from a participating CVS or Walgreens pharmacy is not eligible for the 90-day home delivery discount. The coinsurance and maximum have also increased for specialty medications. Let's see how much you remember about prescription drug coverage with another quiz. Where can you get a 90-day supply of your prescription drugs? A, any retail pharmacy. B, Express Scripts home delivery. C, a CVS or Walgreens pharmacy. Or D, both B and C. The correct answer is D, both B and C. If you recall our prescription coverage section, members can receive a 90-day supply of medication through home delivery or from participating CVS or Walgreens pharmacies. If you'd like more information about our prescription drug program, save these resources for future reference. To find out if your prescription is covered, locate a network pharmacy in your area, or for more information, please go to express-scripts.com/pharmacy or call Express Scripts at 877-438-4449. If you have questions regarding specialty medications, please contact Accredo at 800-803-2523. It's time for our next section, Navigating Travel and Overseas Coverage. When you're traveling outside of the country, it's important to plan ahead and understand your coverage in case you need medical attention. The Compass Rose Health Plan makes it easy for members to stay protected even if you are not in the United States or Puerto Rico. Overseas benefits are the same as stateside in-network benefits. If you need medical assistance internationally, you may see any healthcare provider or visit any hospital. The Compass Rose Health Plan will cover it as though you are in-network. But because there are no international in-network providers, members are required to pay 100% at the time of service and submit a claim for reimbursement. To file a claim for reimbursement, submit your receipt and the detailed billing invoice using our overseas claim form found at compassrosebenefits.com/overseas. Members living or traveling outside the U.S. can receive an extended supply of medication before they leave. Simply have your doctor write a prescription for the amount needed with no refills. This cost will follow the same copay structure as your normal refills. If you obtain your prescriptions through a pharmacy overseas, you are responsible for 10% of the total cost of the drug. Are you feeling good about overseas coverage? Let's put it to the test. Here's your next question. If you are traveling overseas on vacation and need to see a cardiologist, how much can you expect to pay? A, 30% as if it were an out-of-network provider, or B, $25 as if it were an in-network specialty provider. The correct answer is B, $25. The Compass Rose Health Plan will cover any overseas medical treatment as though you are in network. Therefore, you would pay $25 to see a heart specialist overseas. Make sure you're ready for your next international trip. Learn more about overseas coverage and how to file an overseas claim at compassrosebenefits.com/overseas coverage. The next section of this webinar will cover how the Compass Rose Health Plan coordinates with Medicare. Being enrolled in Medicare and the Compass Rose Health Plan can help decrease your out-of-pocket health care expenses. Even though enrolling in Medicare is not required, there are some definite advantages to having both Medicare and the Compass Rose Health Plan. If Medicare is your primary health insurance, your provider will submit your claims directly to Medicare. In most cases, your claims will be coordinated automatically, and we will provide secondary benefits for covered services. When you enroll in both Medicare Part A and Part B and the Compass Rose Health Plan, we waive certain deductibles, co-payments, and co-insurance. Plus, Compass Rose offers prescription drug co-payments at a reduced rate for Medicare Part B participants. Our plan also provides coverage for certain services that Medicare does not cover, such as hearing aids, some vaccinations, and healthcare overseas. Once you are enrolled in Part B, you have the freedom to be seen by any participating Medicare provider without penalty, whether in-network or out-of-network. Now that you know a little more about how we coordinate with Medicare, it's time for another quiz. What does the Compass Rose Health Plan cover that Medicare Part A and Part B do not? A, hearing aids. B, most prescription drugs. C, overseas coverage. Or D, all of the above. The correct answer is D, all of the above. As you can see, being enrolled in Medicare and the Compass Rose Health Plan can help decrease your out-of-pocket health care expenses. Want to learn more about coordinating Medicare coverage with the Compass Rose Health Plan? Visit compassrosebenefits.com/Medicare coverage or download the Medicare and Me brochure at the link on your screen. The last section of our webinar will go over our exciting health and wellness programs available to eligible members. The Compass Rose Health Plan is here to protect you and help you live a healthier life. That's why we offer a handful of free health tools and wellness benefits so you can get the most out of your coverage. One resource to take advantage of is the Compass Rose Member Portal. Through our Member Portal, you can securely access claims, ID cards, locate in-network providers, and more. We can also help you make long-term healthy lifestyle changes with a free weight loss program through Real Appeal. Eligible members receive online tools and trackers, a transformation coach, and a success kit with scales, recipes, workouts, and more. Take advantage of savings with Carrington's Dental and Vision Discount Program, free to plan members. Members have access to discounts on dental and vision needs, such as teeth cleanings, x-rays, dentures, crowns, eye exams, eyeglasses, LASIK, and more. Please note, this plan is not insurance and is not intended to replace health insurance. To reward you for your healthy lifestyle choices, our Wellness Rewards program turns your hard work into dollars. You and your covered spouse can each earn $250 per calendar year by completing qualified activities and screenings, like getting a mammogram or your annual preventive care exam. This money is applied to your deductible or put into a retirement reimbursement account to be used the following plan year. You can also skip the waiting room with our 24/7 free virtual doctor visit service, Doctor on Demand. Board-certified physicians can diagnose, treat, and even prescribe medication to you over the phone, tablet, or computer. Women can also get free access to a nurse coach who teaches healthy lifestyle habits and good medical care during pregnancy through our maternity management program. Participants receive educational materials and their choice of 1 out of 6 pregnancy books. Plus, they can earn 100 reward points. This year, there are more ways to earn wellness reward points, like using Express Scripts' Price a Medication tool or completing an action plan in the UMR Activity Center. Time for your last quiz. Let's test your knowledge on our health and wellness programs. How much do our health and wellness programs cost? A, $50 per program. B, all health and wellness programs are free to eligible members. Or C, programs are covered at 90%. The correct answer is B. All health and wellness programs are free to eligible members. That brings us to the end of our 2020 Compass Rose Health Plan webinar. Thank you so much for participating. You can access the full Compass Rose Health Plan brochure at compassrosebenefits.com/brochure. You can also reach out to the many health plan resources you have at your disposal. For questions around overseas coverage, wellness rewards, Medicare coordination, or other plan questions, call 888-438-9135 from 8 a.m. to 8 p.m. Eastern. For prescription questions, contact Express Scripts at 877-438-4449. Thank you again for trusting us with your coverage. We look forward to serving your healthcare needs.